It is Indiana in the morning. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Good morning. We're glad you're with us here today on this Thursday morning, 7:45. Christa Pontani is with us. She's been at IRMC, as I said, for a lot of years and in a number of different disciplines. Our visit presented this morning by Marcus & Mack, voted Best Law Firm and Best Personal Injury Lawyer 3 years in a row in the Best of Indiana County contest. You can visit them online at marcusandmack.com. Good morning.
Good morning.
It's good to have you with us this morning.
Thank you. Glad to be here.
Well, we talk about this particular issue every year at this time. It is Colon Cancer Awareness Month. And you're now working in gastroenterology.
Yes, that's correct.
At IRMC. Dr. Kramer's office?
Dr. Kramer's office and Bonnie Kramer as well.
Mm-hmm.
So, and I recently joined the practice.
Yeah.
Yes.
Tell me about that decision to join that area.
So, gastroenterology is a medical specialty that focuses on the digestive system and its disorders, but I've always found the digestive system interesting. But more importantly, there's a need in the community for patients to be evaluated in a timely manner, and I believe I can assist the current providers in evaluating patients and making recommendations regarding their GI health.
Colon cancer is a very, very common cancer, isn't it?
Yes, it is.
And it's also a very preventable cancer in most forms.
Correct. And that's why we really recommend appropriate screening. Mm-hmm. So colorectal cancer is cancer of the colon or rectum, and the colorectal cancer is a growth of cells that forms in the lower end of the digestive tract. Most of these cancers start as non-cancerous growths called polyps, and removing polyps can prevent cancer. So healthcare providers recommend screenings. Colorectal cancer is highly preventable with screening.
Yeah. And in most cases, the best way to screen is through a colonoscopy?
Correct. So, colonoscopy. So, a colonoscopy is an exam of the whole colon and using a long, flexible tube with a camera in one way to detect colon cancer and polyps. A colonoscopy is the best screening test available for colorectal cancer. Other screenings include like a stool-based test.
Yeah, that's the ones with the walking box on TV, right?
That's correct.
That thing. But it's not nearly as accurate as actually getting inside the body, inside the colon, and really examining.
Correct. So what we've all heard of Cologuard is intended to screen adults 45 years of age and older who are average risk for colorectal cancer and that's detecting certain DNA markers and blood in the stool. And really, the bottom line is Cologuard is not a replacement for a colonoscopy, especially in high-risk patients. And so that test has to be interpreted with caution. And obviously, patients with a positive test should be referred for a colonoscopy.
Yeah, absolutely. And really, a surgeon is going to tell you, or a gastroenterologist is going to tell you that really, if you want to be sure, and if you have any sort of risk factors at all, that colonoscopy is really what's going to help you learn best about what's going on inside your body.
Yes. And so I think patients may be, a little leery about having a colonoscopy, but it's highly recommended.
Yeah, it's scary for folks because, well, thanks to the stand-up comedian world, the word gets out. And people worry about the prep. The prep seems to be the scariest part of all for them. But really, once you get through an hour or so of that, you're fine.
Right. And, a colonoscopy prep is very important to the success of the procedure. So you receive detailed instructions to follow in the days leading up to your procedure, but the purpose of the prep is to make sure the large intestine is clear as possible for your colonoscopy. And then, of course, the colonoscopy is under anesthesia. So, yes.
You're okay in that respect. So when the surgeon gets inside and is able to really examine the colon and finds a polyp, there are options for the surgeon at that point.
So once we find a polyp and it's removed, It's, of course, sent to pathology. And then we receive a report on the pathology. And then based on the pathology, that will determine the next step in your care.
Yeah. Yeah. So the first step is getting the polyps out of there.
Correct.
Finding out if they are in there, number one.
Right.
That's what the colonoscopy is for. If you do see them, then the surgeon is going to extract that polyp, get that out of there, get it tested. That will help you determine, do I have colon cancer or not?
Yes.
And as we said, it's a deadly cancer. But as Dr. Clark has told us quite often when he's come to visit with us, if you find that polyp, that's where the cancer comes from.
Right. So, and now the guidelines, the American Cancer Society recommends that people at average age risk of colorectal cancer start regular screening at 45.
Mm-hmm.
So I'm not really sure many people know that. So 45 is the new 50. So, and people who are in good health with a life expectancy of, more 10 years, they continue colorectal screening up until, through their 70s. So 75, and then, it all kind of depends on their health.
The incidence of colorectal cancer, the age at which it's being detected, is actually going down. So for some reason, we're finding it in people younger. That's why the new recommendation for 45.
Right. That's correct. Yeah.
Yeah. So all of that, and that is the approach that is best for detecting colon cancer. There are things that people can do to help prevent colon cancer, dietary things, correct?
Yes. So really, to prevent colorectal cancer, Chris, there's no sure way to prevent colorectal cancer, but screening can find abnormal cells. We already talked about that before cancer. But you might also be able to lower your risk for colorectal cancer by changing the risk factors that you can control. So we can't really change our family history or, of course, our increasing age, but patients can maintain a healthy weight. Of course, obesity increases the risk of colon cancer. Engaging in regular physical activity, eating a balanced diet, consuming fruits, vegetables, whole grains, and lean protein. Also, limiting alcohol consumption. Excessive alcohol intake increases the risk of colon cancer. And then also quitting smoking. So smoking is a major risk for colon cancer.
All of those things play a role. And you mentioned the diet and the various things that people eat in their life. And there's a lot of controversy about this diet is going to help you and this diet is going to hurt you and everything. But you mentioned the word balance. That balance is pretty important.
Right. A balanced diet, consumption of fruits, vegetables, whole grains, and lean protein. Maybe more that may place you more at risk is a diet high in red meats. Mm-hmm. Focusing on a good balanced diet.
That's a good thing. And the exercise component is pretty important too.
Right. Obesity, increase in weight. So we always encourage maintaining a healthy weight.
Yeah. All of those things, as we talk about colon cancer risk, and maybe to improve your odds in that respect, the treatment protocol then, if colon cancer is detected and the surgeon then determines that you need to have more work, IRMC has a really good GI team. You're now a part of that team.
Correct.
That can really determine what's the best course. And it can be a number of different options depending upon how advanced the cancer is.
That's correct. Yep. And we have an excellent colorectal surgery team, and we would refer you to them. And as soon as we find the pathology, we start that process right away.
Yeah. Now, you have an event coming up, don't you?
So we do. IRMC is hosting a Business After Hours event on March 26th. And that's at the Hilton Garden Inn, where you can have a chance to meet the rest of the GI team. As I had mentioned before, it's Dr. Kramer and Bonnie Kramer and the colorectal surgeons. And so this is just like a get-together, meet and greet, informal setting, and you can ask questions, you can learn and mingle about colorectal cancer. And that, of course, is in an event that's in partnership with the Chamber of Commerce and free for chamber members and community members. And if you wanted more information, it's 724-357-7188.
Christa Pontani with us this morning, CRNP, IRMC in the GI office now, and working with the doctors, Kramer. And one of the things that you said earlier when we were talking about risk factors and having the colonoscopy earlier, say 45 is the new recommendation for that. How often should someone then have a colonoscopy?
So, the recommended frequency of colonoscopies really depends on the patient's individual risk factors for colorectal cancer. So those with increased risk, such as family history of colon cancer, inflammatory bowel disease, or history of polyps, those patients, of course, will need more frequent colonoscopies. And those patients at high risk or history of polyps removed may need a colonoscopy every 3 to 5 years. So, and risk factors, of course, are family history, increase in age. We had already talked about it's more common after age 50, but colorectal cancer is rising among people who are younger than 50. Of course, certain polyps that are removed from a prior colonoscopy, personal history of inflammatory bowel disease, and then those lifestyle factors that we talked about earlier.
Yeah, all of those different things. Now, if somebody needs to get into the office and get this whole process started, is it always by referral, or can they come directly too?
Well, they can come directly. They can call our office, which is 724-463-1414. I do really believe our primary care providers, internal medicine and family medicine doctors do an excellent job in addressing screenings with our patients in the community. So you can always go through a referral from the primary care office. But, of course, contacting our office as well, which is, again, 724-463-1414.
There you go. And if you want to get registered for this event on March 26th at the Hilton Garden Inn, it is a Chamber of Commerce event. It's free for Chamber members and for the community. If you need any information on that, the usual number, 724-357-7188, and they'll fix you right up. Krista, thanks so much for coming in.
Thank you for
We
having me.
appreciate it. Our pleasure. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. We're just about 3 minutes away from 8 o'clock. Goodness, this morning's going fast. Indiana in the Morning, always presented by First Commonwealth Bank. Time to be first. Fox News is next at the top of the hour, and then it's a visit from Josh in the WCCS newsroom. Coming up, it is what is this day? This is a Thursday, huh? So I'm sure I've got guests in every segment this morning. I just can't remember who the next one is. Krista, it gets that way. I get confused. Here it is. Oh, Maddie Sabo is going to come in and visit us from Quota Club. That'll be good. State Representative Jim Struzzi in our next hour as well. Indiana in the Morning, always presented by First Commonwealth Bank. It is the voice of Indiana County. WCCS 101.1 FM, AM 1160, and WCCSradio.com. It's 2 minutes away from 8 o'clock on your Thursday morning.